This project is on Crimean-Congo hemorrhagic fever, as presented by Bryant, Reagan, CJ, and Megan. Crimean-Congo hemorrhagic fever, or CCHF, is an acute viral infection of the norovirus genus transmitted by ioxidid ticks, particularly of the genus Hyaloma. It can be further transmitted by contact with infected blood or body fluids of livestock and humans, making it a significant risk for nosocomial transmission to healthcare workers. Pathogenesis of this virus is poorly understood, but we do know that it is a single-stranded RNA that replicates after cell adhesion, even though we don't completely understand how it gets into the cell. We do know that this is a tick-borne maintenance and transmission virus, which means that infection either occurs after an infected tick bite or contact is made with the contaminated bodily fluid, blood, or tissue of an infected human or animal. There is a brief incubation period which usually lasts less than 7 days. During this period, nonspecific symptoms occur, such as rapid high-grade fever, fatigue, headache, back and joint pain, red eyes, flushed face, and myalgia accompanied by vomiting and diarrhea. Progression over the first week of infection leads to thrombocytopenia, elevated circulating liver enzymes, petechiae, ecchymosis, epistaxis, gingival hemorrhage, gastrointestinal hemorrhage, and cerebral hemorrhage. In patients that recover, signs of improvement generally begin around the 10th day after onset of illness. However, in fatal cases, death usually occurs in the second week of infection and is a result of disseminated intravascular coagulopathy, shock, and multi-organ failure. Around 30% of all cases are fatal. Diagnosis can be confirmed by several laboratory tests, including ELISA, an enzyme-linked immunosorbent assay, antigen detection, serum neutralization, virus isolation by cell culture, and RT-PCR, which stands for reverse transcriptase polymerase chain reaction. There is no designated standard treatment or cure. However, there has been some success with ribavirin, and also we give general supportive care. CCHF is endemic in Africa, the Balkans, the Middle East, and Asian countries south of the 50th parallel north. Patient education is very important with this virus, including the use of insect repellents and proper clothing barriers. All patients with CCHF should be on droplet precautions, and we need to understand that most cases involve individuals in the livestock industry. Any samples taken from patients for testing should be conducted under maximum biological containment conditions. All of this information is very important in understanding and controlling the spread of CCHF. Thank you for listening to our presentation.